Why do you need a radioactive iodine uptake test? Imagine trying to understand how well your thyroid is working without opening it up. That's where a radioactive iodine uptake test comes in. It's a safe, non-invasive way for doctors to see how your thyroid absorbs iodine, which is essential for making thyroid hormones that control your metabolism. This test is especially helpful if your doctor suspects a thyroid disorder like hyperthyroidism, where the thyroid is overactive, or if they want to check how well treatments are working. The main goal of this test is to measure how much radioactive iodine your thyroid takes in. You swallow a tiny amount of radioactive iodine in liquid or capsule form. After about 4 to 6 hours, and again after 24 hours, a special device measures how much iodine your thyroid has absorbed. This helps doctors understand if your thyroid is producing too much hormone or not enough. Doctors use this test for several reasons. First, it helps diagnose thyroid conditions. If your thyroid takes up a lot of iodine, it might be hyperthyroidism caused by conditions like Graves' disease. If it takes up less iodine, it might be thyroiditis or other issues leading to low hormone production. Second, it's useful for monitoring how well treatments like radioactive iodine therapy are working, especially if you've had thyroid cancer or hyperthyroidism. The test can confirm if all the problematic tissue has been treated or if any thyroid cells remains. Lastly, after surgery or therapy, it helps verify that no remaining thyroid tissue could cause problems later. Preparing for the test is simple but important. You'll usually need to fast for a few hours beforehand and avoid foods rich in iodine, such as seafood and dairy, because they can interfere with the results. The procedure itself is painless and involves swallowing the radioactive iodine, then having measurements taken at specified times. Interpreting the results is straightforward. Normal iodine uptake ranges from about 15 to 25%. If your uptake is higher than this, it suggests your thyroid may be overactive. If it's lower, it could mean thyroiditis or other issues affecting hormone production. It's important to remember that these results are just one piece of the puzzle and should be considered alongside other tests and clinical findings. Safety is a priority, so this test isn't recommended for pregnant or breastfeeding women because of the radiation exposure. Always discuss your medical history and any medications with your healthcare provider before scheduling the test. They can provide guidance on how to prepare and what to expect. In essence, a radioactive iodine uptake test gives valuable insights into how your thyroid functions. It helps doctors diagnose thyroid disorders accurately and monitor treatment progress. If you're experiencing symptoms like unexplained weight changes, rapid heartbeat, or fatigue, talk to your healthcare provider about whether this test might be right for you. Remember, every person's situation is unique, so personalized medical advice is always the best course.